Hi, welcome to Medicare Explained NC. Sponsored by BenefitCare.com. In this lesson, we're going to explore that when it comes to the price of healthcare. Why Medicare costs less. Here is what we'll cover in this session. What the difference is in the cost of healthcare between private insurance and Medicare. How Medicare controls the cost of healthcare services and equipment. And how Medicare helps subsidize the cost of healthcare to keep what you pay low. Medicare controls the cost of care in two ways. First, by setting prices for all Medicare-approved healthcare services and equipment. Second, by paying for part of the cost of care through government subsidies. Combined, these two ways can significantly lower the overall cost of healthcare for Medicare beneficiaries. Now let's take a look at some examples. In general, there are three basic prices for healthcare services and equipment. First, there are the hospital billed charges, or retail price, also known as the list price. This is the price established by a hospital. Then there's the contracted price or negotiated price. This is the price negotiated between a hospital and a health insurance company. These prices vary between insurance companies. This is the price you pay if you have private insurance. Then, there is the Medicare Allowable price. This is the price as determined by Medicare to be fair and reasonable for Medicare-approved services and equipment. This price is non-negotiable. This is the price Medicare beneficiaries pay when on Medicare. This is one of two ways Medicare beneficiaries pay less for healthcare services and equipment. Under Original Medicare, Part A and Part B, there are no provider networks like in private insurance. You can go to any doctor or hospital that accepts Medicare. In general, the price you pay for healthcare, when you're on private insurance, can vary widely, from under 100% to over 400% of Medicare, depending on the healthcare provider you choose. Generally, there is little correlation between the cost of care you pay for and the quality of care you receive. That is why it's important that you do your research first. Medicare has online tools to help you with this research. Another way Medicare keeps the price you pay for healthcare low is by subsidizing part of the cost of care. Overall, the government subsidizes a total of 41% of all Medicare expenses. For example, the government subsidizes 1% of Medicare Part A, the remainder is paid for by payroll taxes. 71% of Medicare Part B, and 73% of Medicare Part D. In addition, Medicare pays insurance companies offering Medicare Advantage Part C plans, a fixed amount per month to cover the cost of care. Whether you choose Original Medicare, Part A and Part B, with a Part D plan, or choose a Medicare Advantage Part C plan, the overall cost of healthcare is lower with Medicare, compared to private insurance. However, Medicare is not without its costs for most people on Medicare. There are deductibles and coinsurance associated with Medicare Part A and Part B, that are the responsibility of Medicare beneficiaries. These costs change every year. That is why many choose a Medicare supplement, also known as a Medigap plan, to cover most of these costs. For lower income people, there is additional help available. Medicare Part D prescription drug plans also have deductibles, co-pays, and coinsurance. The amount you pay depends on both the specific drugs you take and the plan you choose. These costs also change every year. For lower income people, there is additional help available. The monthly premiums you pay for Medicare varies. For example, most people get Medicare Part A, hospital insurance, at no charge, if you paid payroll taxes for at least 10 years. For most people, in 2021, the standard monthly premium for Medicare Part B medical insurance is $148.50 per month. If you are a higher income earner, you'll pay more. For Medicare Advantage Part C plans offered by insurance companies, monthly premiums vary depending on the plan. You must still pay your Medicare Part B monthly premiums. Finally, monthly premiums for Medicare prescription drug Part D drug plans offered by insurance companies also vary depending on the plan. Higher income individuals will pay more. For lower income people, additional help is available. For more information about Medicare, search for Medicare information at official government websites. This video series is sponsored by BenefitCare.com, home of senior benefits like Medicare Advantage plans, Part D plans, Medicare supplements, and other senior benefits. Look for more videos on Medicare basics at BenefitCare.com.